This is Things I Need to Learn in Life I Didn't Learn in School, covering everything we should know as adults that got glossed over in our classrooms. With your host, Wave News anchor, Dawne Gee.
Thank you so much again for joining another episode of Things I Need to Learn in Life I Didn't Learn in School. This one, everyone needs to know. This one I bet everyone has had trouble with, and that is insurance. I say the word, and I want to beat my head against the wall. Honestly, I do. Susan Bornstein is here. Susan, I'm going to let you give all of your credentials because there are many.
You're very sweet. So I am a physician by training, an OBGYN, and I actually got so frustrated with the issues that my patients were having with cost and access to care that I went back to school for a master's in public health, thinking that it would make me a more credible advocate on their behalf. And making a long story short, I ultimately wound up founding a nonprofit, the Asclepius Initiative, of which I am now the CEO. Asclepius represents medicine and healing in Greek mythology. And there are just so many wonderful organizations with the words Kentucky and health in them, but I do get them all mixed up. So instead I picked something that no one can spell, pronounce, or remember, but at least you'll recognize it if you see it again.
Well, there you go. It's important. I've had a chance to talk to you before, and you had wonderful information. It's just fabulous, and it's things that we need to know. And I've had a few battles. I've had a few health problems. Well, I have health problems always. But just lately, my latest health problems, and I've really had to battle my insurance. And I mean, I was just like, what? And we've been working it out, and I'm grateful for them, but it can not be good. First thing, though, I know you talk about the key factors when you're considering comparing health insurance plans. Not everybody gets to do that. Like here, this is what you have, but we still have to decide, do we want the lowest, what is it, copay? Do we want the highest copay? Talk about that and how important that is.
I will. I want to go back to what you were saying a minute ago, though, because I think it's so important, and I was just talking about this the other day. Nobody teaches about healthcare coverage, right? So your parents teach you maybe about financial things like how to balance a checkbook or how to save money.
You hope they do.
You hope they do. They teach you how to do laundry, you hope. Got a funny story about how my husband turned all of our whites red very early on in our relationship, but that's a whole nother story. But nobody teaches this. The parents don't teach it because most of the time they don't understand it. It doesn't get taught in primary school, secondary school, post-secondary education. It's just not taught by anybody. And so it's no surprise that people wind up being really confused about how it works. And if you're lucky, to answer your question, if you're lucky, you may get some choices, for example, about what kinds of plans you can pick from your employer. Sometimes there isn't but one choice. Other times there are a choice. If we're I like to think of it as sort of three main things to think about when you're trying to control health insurance costs. One is picking the plan, right? And I can go into that a little bit more in a minute. The other is whether or not there are health savings programs that could go along with your plan.
And that's taking money out of your check and putting it away so you can use that to pay your bills.
Exactly. And most of the time that money that is taken out of your paycheck is taken out on a pre-tax basis. So you save money. So for example, if you normally would get paid $100 and you'd pay $20 in taxes, then you have only $80 left to spend, let's just say, for your healthcare costs. Whereas if it's taken out pre-tax, you have that whole $100 to spend. So it really does put money into your pocket.
For an example about the money that's taken out, on one of my surgeries this year, I had met my deductible, I thought, anyway. And when I had the surgery, they went, oh, well, you owe $1,600. And I was like, well, I thought I met my deductible. I shouldn't have to pay, and I had to pay. But I looked at my savings card, my flex card, And I had the money there, and oh my goodness, I was grateful.
Exactly. And then the third way to save money, which is way complicated, is to know how to read your insurance documents and the bills that come from the whoever you received the services from, as well as understanding what's called the explanation of benefits form that comes from your insurance company. And being able to put all that together can really help you save money, because a lot of times errors are made somewhere along in that process.
Okay, so let's be honest. How many people do that, and who can do that?
I would say very few people do it.
Yeah.
Very few. And it's not a smarts kind of thing. It's that people just don't understand. But I have, and I'm a little ashamed to admit it, I have a super adversarial approach when it comes to whenever I get a bill in the mail, my first thought is, prove it to me. Prove to me that I owe you this money. If you satisfactorily prove that I owe you the money, I'll be happy to pay you the money for the services that I received. But I've been charged for x-rays I never had done. I was charged for a well woman exam that's a preventive service that should have no out-of-pocket costs associated with it. And I was charged $800 for a colonoscopy where the claim had been denied due to late filing, and on that explanation of benefits form it said patient responsibility 0. I owed nothing, and yet the provider tried to bill me $800.
So we need to look at all of that.
It's really
I'm not sure
important
that
to
I've
know.
ever looked at it.
So we have a lot of resources on our website. People can go to allinallinsured.org or .com, and we have a whole section on our website under the Learn More on the drop-down, and we have videos and webinars and even animated little clips that can walk people through some of these things and teach them more.
Okay, say the website again, please.
allinallinsured.org.
Okay, there we go. Trying to make sure I ask you everything. When it comes to premiums, deductibles, copays, out of pocket, and I could be wrong here. I always get the premium one. I get but that's because I'm sick. And then I look at the kids that are here, and they get the one where if they end up breaking a leg, they're going to be broke. And I get so scared for them. And I go, no, get the premium one. Does it matter which one we get?
It absolutely matters. And again, we have a spreadsheet on the website that can help you with this. But I think of it like this. A lot of people think about the deductible. The deductible is just a ledge, right? It's a ledge you have to hit before something else happens. And the main things to think about when looking at prices are your share of the premium, right? You don't care what your employer pays because that's not on you. The employer might care, but you don't care. You care if your employer doesn't pay 100% of the premium. You care what your share is. You care what the deductible is, because your insurance company isn't going to pay anything other than for preventive services until you hit that deductible. So you might care what the deductible is. The co-pays and the co-insurance are important, but maybe not as important as some of the other factors. And then the other super important thing is what's called the out-of-pocket maximum, which I'm told in the industry is known as the MOOP, M-O-O-P.
What does that stand for, the MOOP?
Maximum out-of-pocket.
Okay.
So basically, the way that I like to think about it, and it's a little bit hard to conceptualize without charts and graphs and all that kind of thing, but I like to think in terms of looking at what's called what I call the total exposure. In other words, if the absolute worst happens and you have tons of medical expenses, what's the most that you would be on the hook for from a covered services standpoint? And that number is going to be your total annual premium contribution, right? So whatever you pay each month times 12, plus the out-of-pocket maximum, which is the most that you would have to pay in those co-pays, deductibles, co-insurance, right? Once you've hit that out-of-pocket maximum, you don't pay anything more for covered services. So the total exposure is the total premium plus the total out-of-pocket maximum.
So you have to play those two, and
So
then
you
they'll take
add
over.
those two
Okay.
together, and that'll tell you what's the most that you could have to spend potentially in a year.
Before they take over everything.
Before they take over everything. The deductible, as I was saying, is just a ledge. So they're not going to pay anything other than preventive services before you hit that ledge, right? You're on the hook for all of it. But once you hit that ledge, you're still likely responsible for co-pays, co-insurances, et cetera, until you hit the maximum out of pocket. So you're still going to be paying something. And the way to think about it, or the way that I like to think about it, is what's the total that I might have to spend, the total that I'm going to have to spend if I have no healthcare expenses in the year. I'm still going to have to pay the premium, right? So you were saying you might pick the one with the higher premium, but what if the higher premium plus the maximum out of pocket in that plan is greater than the one with the lower premiums, even if it has a higher out-of-pocket maximum? Those two numbers together are frequently still less than picking the one with the higher premium.
In my mind, I try to pick the one that's going to give me the best service. You know what I mean? Because I know that I'm going to have surgery. I know that something's going to go wrong. So, I'm always like, okay, I'm going to pick the one that's going to give me the most.
Well, usually for a given carrier, what they give you in terms of access, because the network is important also, right? So when you're looking at different plans, you want to find out if they have the same network. You don't want a plan that doesn't cover your doctors.
And that's so bothersome too, this network that you can't, that they charge you more. Like if your doctor's not in the network, they're going to charge you more.
Correct.
That's not right. Because I don't want to change my doctor.
Right.
Because it's not in the network.
Right.
Because wait a year or two, and then your company's going to change their insurance. Oh, and then your doctor's in the network, but you got rid of her.
And the doctors can drop out of the networks at any time.
And that's frustrating.
So one of the things we hear a lot is, well, I checked and they were in it, but then by the time I went, they weren't. Because that can change, and the insurance, the website lists are not always up to date. Sometimes they're just wrong. And so it can be extremely frustrating to try to make sure that the people that you want to see are in network, and particularly if you have an HMO, those plans are more restricted geographically, so you have fewer choices to go outside of a certain geographic area. So if you decided you wanted to go live in Colorado for 3 months, you might not have any coverage other than emergency care.
What's better, an HMO or what's the other one?
PPO?
PPO.
PPOs tend to have a much broader network.
Doesn't mean
HMO.
they're better, but they're broader.
They're broader.
Okay. You talked about when somebody sends you a bill, prove it. How do you appeal, or how do you...
If you find a mistake?
Yeah, how do you just say, no, this isn't right? Because they're going to fight you. How do you even start that battle?
So sometimes it can take a really long time. One of my favorite stories is I had, I just figure if all these things are happening to me, they're happening to everybody else, because there aren't any arrows pointing at my head to say only mess with Susan Bornstein's bills, right? But I had this situation where the amount that was increasing on my deductible, in other words, how much was adding to the deductible with each claim, right? You go to the doctor and $10 goes to your deductible, and then 2 visits later, $30 goes to your deductible until you hit your deductible. Well, in this really funny case of funny insurance math, the amount attributed to my deductible was going down with each claim instead of up. And it took 3 months and multiple spreadsheets to get it straightened out.
Not everybody can do spreadsheets. I don't think that I can do spreadsheets.
That's why I feel so badly that that the system is so incredibly complicated.
Are there tools to help?
We have tools on our website. that can walk you through how to reconcile your medical bills and look at them, how
And
to
that's what it's
decode.
called, reconcile, you
That's
fix it.
Reconciling it is making sure, like when you get a statement from your bank account each month, nobody does this on paper anymore except for me, but you have your checkbook and...
No, I do that. I don't balance my checkbook, but if I would do it on paper.
On paper. So you have your checkbook, right? And then you have what the bank says is in your checking account. And then, at least when I was growing up, I was taught to reconcile those every month. So I make sure that what the bank says I have and what my checkbook says I have are the same thing.
So they don't mess up.
So that I can catch mistakes.
Yeah.
And you can do that same thing with your medical bills if you have all of your documents and understand how to read them. And we explain how to read those on the website.
What's the most important thing we need to know about insurance? Is there a 1, 2, 3 about make sure you know this and this and this?
I don't think so because
No.
it's so complicated.
It is.
I mean, there's so many different things that you need to know. And even for people like me that think about this stuff every day, I have to look it up to try to figure out, am I giving the right information?
Did we talk about that? The difference between HSAs, FSAs, and HRAs?
No, but I can talk about that.
What is that?
So those are great ways to save money.
Is that like a flex card?
They're all slightly different.
Okay.
The IRS makes rules that govern the specifics of each of those programs. But an HSA or a health savings account is the most flexible way to save money.
You get to roll that money over.
You can roll, it's your money.
Because sometimes you get a plan and you have to use it by the end of the year.
Correct.
Or you lose it.
That's a flexible spending account.
Okay.
And so they're very different. And what types of plans you can use them with are different. The amounts that you contribute are different. But an HSA has the highest limits. You can contribute $4,300 as an individual or $8,550 as a family for 2025. The numbers change every year. And if you're over 55, you can put in an additional $1,000. And that money is tax-free. It can go into interest accounts that grow interest or earn interest. It rolls over from year to year, and it's always yours. Even if the HSA is through your employer, you can take it with you when you leave. Whereas a flexible spending account has a lower maximum contribution rate of around $3,000 and in 2025, and it's your employer's money. You and your employer can contribute, but when you leave, you usually have to leave that money with the employer, and only about $660 can get rolled over from one year to the next in 2025. So if you had $3,000 in there one year and you didn't spend any of it, you can only roll over $660 to the next year.
Do you think those are important to have?
I think they're super important to have because, again, it's tax-free money that can be used for qualified medical expenses. So they can be used to pay those co-pays and co-insurance and deductible costs. The only thing they can't be used for are to pay your premiums. Now, in an HRA, those are owned by the employer. Those are called health reimbursement arrangements, and that the employer, in that case, basically the employer says, well, I can't give you health insurance, but I'm going to set aside so much money per employee per year that you can use to pay healthcare expenses, and those can be used to pay premiums as well as the qualified medical expenses.
Okay, we are so running out of time, but we got to get some of this in. Effective ways to reduce healthcare costs. You have a few ways here. Can we talk about that?
Absolutely.
Okay, you say utilize preventive care services. Stay healthy, I guess, basically.
Right, and go for your pap smears, go for your mammograms, go for your colonoscopies, go for your blood pressure checks so that if you have high blood pressure, it can get diagnosed and get treated before you have a heart attack or a stroke. So getting preventive care is super important and can not only make you better, but lower your costs in the long run.
Yeah, because you won't be like me in the hospital all the time. But I get that preventative care. It just doesn't always work out.
Many times you can take generic medications, which can
That
cost
saves
less than
money.
brand. That can save money. And there are a number of different services that you can access that'll allow you to compare pharmacy costs. So there are tools
Do you
that you can
like
use.
those little cards? What do they call you? I can't remember. You can go and see if there is a copay card or something to get cheaper
You
medication.
can see that, and there are also apps that you can use where you can put in the medication that you're interested in and the dose and the quantity, and it'll tell you the price at all the pharmacies within the range of the radius of the zip code that you put in.
Do you like those?
I love those.
Okay.
I use them all the time.
Telehealth for non-emergency issues. I know this is getting big. Do you like telehealth and it saves money?
I think telehealth is great for certain situations. Certainly can be helpful for people who live in rural areas or people who have transportation problems. It's not great for every situation. Can be super good for mental health, right? Because you don't need a physical examination. Right. So it gives people broader access to mental health services.
And some type of privacy even.
Right.
Because you can do it anywhere, in your car, in your home.
In the waiting room.
Yeah, you're not sitting in a waiting room with 10 other people.
And then one of the other things that I thought of after we put an initial list together is look at all of your options for getting healthcare coverage, because sometimes even if your employer offers health insurance, there are times when you can still get your health insurance on the marketplace and it can be less expensive. So something else to think about.
You say negotiate costs for planned procedures, like if somebody's going to do your knee and you know it's coming up in 2 months or so. I have never negotiated. I never even negotiated for a car, although my dad, he'll negotiate for everything. That's kind of like bartering.
That's primarily for people who don't have coverage.
Okay.
Because if you have insurance coverage, in most cases those rates have already been negotiated between the provider or the person providing a service and your insurance company, and they've arrived at a predetermined rate, so they may or may not.
So nothing you can do, but if you don't have insurance.
That you can do about it. But if you don't have insurance, absolutely worth negotiating, and you can frequently get this. You can frequently find a way to come to some kind of a compromise, and also many healthcare facilities have programs for people who are not insured that can help lower costs.
When you say not insured, I get sick to my stomach.
It's a big problem.
I can't imagine someone not insured. I mean, if my kids were not insured, and I'm blessed and able enough to do this, I would pay for their. My heart would beat so fast every day that something would happen to them. I would just go ahead and pay for the insurance. It would scare me to death. Because I look at my bills, and maybe I don't look close enough, Susan, so I know this.
I'll help.
But I look at my bills, and one surgery is $196,000, and I'm like, holy crap!
Right.
What did they do to me? That was $196,000. Not to diminish the doctors, but the bills are so high. What do you do if you don't have insurance? Would they make you pay that?
They can officially make you pay that. I mean, that's the charge, and you had the service. Often they won't, but yeah,
does that stay on your credit?
There are new rules surrounding that, and as I understand it, medical debt of less than $500 is currently not reported to credit monitoring agencies, and there's some interest in taking all medical debt off of that, but at the moment, the U.S. is one of the few countries, or maybe the only developed country that has medical debt as a problem.
Really?
Yeah, in other developed countries, there are systems in place that they make sure that everybody's covered, has healthcare coverage, so they don't have the same issues that we have here.
Before I let you go, I know that you're trying to talk to people and just kind of get some answers. What is that about?
Thank you. I really appreciate that. So in Kentucky, our uninsured rate is relatively low. Now, I'm with you. I think it should be 0, but it's relatively low. And yet we have some of the worst health outcomes of any state.
Yeah, more cancer, more diabetes, more everything.
All sorts of stuff that we don't want to be, that we're not proud of. And we're trying to find out why that's the case by talking to Kentuckians throughout the state. We want diverse input. We have a grant to do this work. We are conducting most of these talking sessions online, and people will be given a $50 Amazon gift card for their time. To qualify as a participant, you need to be a Kentucky resident between the ages of 18 and 75. You need to have either Medicare, Medicare Advantage, Marketplace coverage, employer-sponsored coverage, or Medicaid. You can't work in healthcare, you can't work for a health insurance carrier, and you can't work in advertising just because those categories could create bias in the study results. And anybody who is interested can call, I have to put on my cheaters, 502-709-7283. And I'll repeat that in case anybody's grabbing a pen.
Repeat it at least 2 more times here.
502-709-9283. 502-709-9283. Again, you get a $50 Amazon gift card for your time. If you call that number, we'll walk you through how to answer a few questions to make sure that you qualify. The other thing that I should add is that the grant that we have, we're a nonprofit organization. We do not sell health insurance. I know some people can get a little confused about that when they look at our website, but our goal is just to help people. And so
you want to make sure people are informed about insurance, they don't get overbilled, that they know how to pick the best of what will help them, and that they just know everything about insurance in and out, and that it's not the beast that seems to eat our heads off.
It is the beast.
Okay, it is the beast that eats our heads off.
But I believe that knowledge is power, and the key to and the first step in the path to greater health. And so anything that we can do to help people with this incredibly complex process, we want to help.
Okay, I'm going to have you come back. So think about the things that you want to talk about, because I just feel like we just brushed the dirt off today is what I feel like. Let people know again about the website, where there are tools there, there's information there, there's videos there. Where can they go again?
Absolutely. It's allinsured.org, and it's completely free. There's no charge for anything on the website. All right. And we have a lot of information about the system, but specifically tools that can help you. And, I didn't mention this, that we have drop-down menus on many of the pages that allow the content to be translated into English, French, and Somali, and we're in the process of adding additional languages as well.
All right. That's wonderful. Thank you so much.
Thank you, Dawn. It's been nice chatting with you.
Susan Bornstein, just getting us through this system. It seems to be getting harder by the day. It really does. Things I need to learn in life I didn't learn in school. I hope you appreciated that lesson. Thank you again for listening or watching.